Pregnancy is a time of joy and anticipation, but it also comes with a heightened awareness of health and safety. Expectant mothers want the best for their babies, and that includes protection from preventable diseases. The COVID-19 pandemic has raised many questions about the safety and importance of vaccination during pregnancy. The good news is that extensive research and real-world data have demonstrated that COVID-19 vaccines are safe and effective for pregnant women. These vaccines offer crucial protection against severe illness, hospitalization, and pregnancy complications related to the virus. Choosing to get vaccinated during pregnancy is not just about protecting yourself. It's also about giving your baby the best possible start in life. Vaccines provide antibodies that can be passed on to your baby, offering them protection during their vulnerable first months. In this comprehensive guide, we'll delve into the science behind COVID-19 vaccines, address common concerns, and empower you to make informed decisions about your health and the well-being of your precious little one. COVID-19 vaccines offer significant benefits for pregnant women, primarily by reducing the risk of severe illness, hospitalization, and death from the virus. Pregnant women are considered a high-risk group for COVID-19 complications due to changes in their immune systems and respiratory function. Studies have shown that pregnant women who contract COVID-19 are at an increased risk of preterm birth, low birth weight, and stillbirth. Vaccination significantly lowers these risks, providing peace of mind during an already challenging time. Moreover, COVID-19 vaccines offer the unique benefit of antibody transfer. When you get vaccinated during pregnancy, your body produces antibodies that can cross the placenta and provide your baby with passive immunity. This protection is especially critical during the first few months of life when babies are most vulnerable to infections. By choosing vaccination, you're not only protecting yourself from the potentially devastating effects of COVID-19, but also giving your baby a head start on their own immune defense. One of the most common concerns among pregnant women is the safety of COVID-19 vaccines. Rest assured that extensive research and monitoring have consistently shown that these vaccines are safe for both mother and baby. Millions of pregnant women worldwide have received COVID-19 vaccines, and the data clearly indicates no increased risk of miscarriage, birth defects, or other pregnancy complications. The vaccines have been rigorously tested and meet the highest safety standards. It's normal to have questions about potential side effects. Like any vaccine, COVID-19 vaccines can cause mild side effects such as pain at the injection site, fatigue, headache, or muscle aches. These side effects are usually temporary and a sign that your body is building immunity. If you have any concerns about vaccine safety, don't hesitate to discuss them with your healthcare provider. They can provide you with accurate and up-to-date information based on your individual health history and risk factors. Misinformation and myths about COVID-19 vaccines have circulated widely, causing confusion and fear, especially among pregnant women. It's essential to rely on credible sources of information and separate fact from fiction. One persistent myth is that COVID-19 vaccines can cause infertility. This claim has been debunked by numerous scientific studies and medical experts. There is no evidence to suggest that vaccines impact fertility in men or women. Another myth claims that vaccines can alter your DNA. This is scientifically inaccurate. COVID-19 vaccines work by teaching your immune system to recognize and fight the virus. They do not interact with or alter your DNA in any way. It's crucial to rely on information from trusted sources, such as the Centers for Disease Control and Prevention, CDC, the World Health Organization, WHO, and your healthcare provider. These organizations base their recommendations on scientific evidence and prioritize public health. Section 5. Making the right choice. Your health, your decision. The decision of whether or not to get vaccinated during pregnancy is deeply personal. While the evidence overwhelmingly supports the safety and benefits of vaccination, it's essential to make a choice that aligns with your values, beliefs, and individual circumstances. Take the time to gather accurate information from reliable sources, talk to your healthcare provider, and weigh the potential risks and benefits. Consider your overall health, any underlying medical conditions, and your exposure risk to the virus. Remember that vaccination is not just about protecting yourself. It's also about protecting your baby, your family, and your community. Vaccines are a powerful tool in the fight against COVID-19 and play a crucial role in reducing the spread of the virus and preventing severe illness. Section 6. Seeking guidance, trusted sources for accurate information. Navigating the abundance of information about COVID-19 vaccines can feel overwhelming. It's essential to rely on credible sources to ensure you're making decisions based on accurate and up-to-date information. Your healthcare provider should be your primary source of information and guidance. They can answer your questions, address your concerns, and provide personalized recommendations based on your medical history and individual risk factors. Reputable organizations like the Centers for Disease Control and Prevention, the World Health Organization, and the American College of Obstetricians and Gynecologists are excellent resources for evidence-based information about vaccines and pregnancy. Section 7. A community of support sharing knowledge, empowering choices. Making informed decisions about your health is essential, and it's often helpful to connect with others who are going through similar experiences. Sharing knowledge, experiences, and concerns can provide valuable support and empower informed choices. Talk to your partner, family members, and friends about your thoughts and feelings regarding vaccination. Consider joining online forums or support groups for expectant mothers where you can engage in open and honest conversations about vaccine-related concerns. Remember that every individual's journey is unique, and there's no right or wrong answer when it comes to making decisions about your health. The most important thing is to gather accurate information, weigh your options carefully, and choose what feels right for you and your baby. Section 8. Protecting future generations. The importance of herd immunity. Vaccination is not only about individual protection, but also about community health. When a significant portion of the population is vaccinated, it creates a phenomenon known as herd immunity. Herd immunity occurs when enough people are immune to a virus, making it difficult for the virus to spread. This protection is especially crucial for those who are unable to get vaccinated, such as newborns, people with certain medical conditions, or those who are immunocompromised. By getting vaccinated, you're not only protecting yourself and your baby, but also contributing to the collective effort to protect the most vulnerable members of our society. Vaccinations are a testament to our interconnectedness and our responsibility to safeguard the health of future generations. Section 9. Conclusion. Your well-being, our priority. Pregnancy is a time of great joy and anticipation, but it can also be a time of uncertainty and concern, especially during a global pandemic. The decision of whether or not to get vaccinated against COVID-19 is deeply personal and should be made in consultation with your healthcare provider. Remember that you are not alone in this journey. Reliable information, compassionate healthcare providers, and supportive communities are here to guide you. By prioritizing your health and well-being, you are giving your baby the best possible start in life. If you have any doubts or questions, reach out to your healthcare provider or consult reputable sources like the CDC or WHO. Your health and the health of your baby are our top priorities.